G'day, it's Paul. This case is a sputum specimen from a 74-year-old male who presented with hemoptysis and a suspected lung cancer. What did you think of this? So there was a lot of mucin, debris, some squamous cells, and quite a lot of pulmonary macrophages scattered through the mucin. There was also some atypical cells, and they were in kind of loose disorganized groups and streams of cells, often embedded in the mucus. On high power there were some chains of cells, I think, with some moulding there. Cytoplasm was essentially absent from most cells. They were just nuclei, which were varying in size a little, but also in shape from round to more elongate cells. Many of them showed degenerative changes. Hyperchromasia was quite extreme, and there was many that had just opaque chromatin pattern, but did show some examples of cells that were better preserved and had stippled chromatin, inconspicuous little nucleoli, and there were areas, I think there was moulding, although I've seen better examples of that. So in summary, we thought this was suggestive of small cell carcinoma of the lung. This was confirmed with a transbronch biopsy, which showed morphology and an immunoprofile in keeping with small cell carcinoma of lung. So there are a few differential diagnoses you have to consider with possible small cell carcinoma of lung in sputum. Probably the most common one is degenerate bronchial epithelial cells. It can sometimes appear stripped, so with bare nuclei that kind of stick together a bit. And usually it's possible to match those back with intact ciliated bronchial epithelial cells in the specimen. Lymphocytes are, of course, a possible concern as well. These are rarely seen in sputum specimens, but when they present either benign or malignant, they can look a little like small cell. They sort of stream in mucin strands, a bit like it. The principal feature that separates them, I think, like this case I've illustrated here, is the cytoplasmic border around the lymphocyte that's usually seen. They can vary quite a bit in size, but generally are nice and round rather than moulding into each other. Finally, other malignancies that are small-celled need to be considered, such as metastatic breast or prostate cancers and small cell variants of squamous cell carcinoma, like this example here, can also cause quite a bit of confusion with small cell carcinoma as well. Any prominent nucleoli that are seen in these sort of cases, you need to really reconsider a diagnosis of small cell carcinoma. So I hope you enjoyed that case. Thanks for watching.